Have you ever wondered if your concerns in the pelvic and low back area could actually be due to your pelvic floor? If so, I have a really amazing screening tool for you, and we're going to go through it together. So please grab a pen and paper right now, something to write with, and go ahead and write down 10 questions. So 1 through 10 on your piece of paper, and I'm going to take you through the Cozean Screening Protocol for pelvic floor dysfunction. And this was created by my friend and colleague, Nicole Cozean. She's a physical therapist. She's amazing. So many times these long-standing issues are almost like mystery conditions, and in some cases, working on and taking a look at the pelvic floor can be like the missing key. So let's go through the screening protocol together, and at the end, I'm going to give you some tips for how to get started if you think that you do actually have pelvic floor dysfunction that's contributing to your concerns. So grab that pen and paper right now. Remember, there's 10 questions, and I'm going to take you through them one by one. The screening protocol says to check all that apply, but since you don't have these check boxes that I do, go ahead and just write the number of the question, and then if you have a positive answer, just put a check mark next to the number. So for example, this first question is question number 1. Put a check mark next to question number 1 if you sometimes have pelvic pain in the genitals, perineum, pubic, or bladder area, or pain with urination that exceeds a 3 on a 1 to 10 pain scale. So on this pain scale, 1 is basically like no big deal. 10 is the worst pain imaginable. So imagine that you have to you're thinking call the ambulance type of pain. That's 10. So think about your personal pain number, and just to explain the word perineum, if you're not sure what that means, and that is the area between the vagina and the anus in women, the vaginal opening in the anus, and in men, it's that area between the testicles and the anus. Question number 2, I can remember falling onto my tailbone, lower back, or buttocks, even in childhood. So really think back in this one. So often I used to have patients who would tell me, I don't really think this matters, but when I was a kid, I fell off a horse or I fell off a ladder or whatever it may be. And oftentimes that really does matter. So really think back. And if you can remember something, put a check mark next to this question number 2. All right, question number 3. I sometimes experience one or more of the following urinary symptoms: accidental loss of urine, feeling unable to completely empty my bladder. So in other words, that's when you feel like there's something left in there after you go pee. Feeling like you have to void within a few minutes of a previous void. So that would be the sensation where you feel like you always have to go. You just always, your bladder is the size of an acorn. You always have to go. Pain or burning with urination, or difficulty starting or frequent stopping and starting of a urine stream. So if any of those are true for you, go ahead and put a check mark next to question number 3. Question number 4, I often or occasionally have to get up to urinate 2 or more times at night. So again, getting up maybe once a night, not a big deal. 2 or more times, that's when you go ahead and put a check mark next to question number 4. Question number 5, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out of place. So for females specifically, this sensation can happen for both men and women, but for females specifically, this might feel like you have a golf ball in your vagina, something sort of in the vaginal canal. Sometimes it's described as like a dry tampon feeling. So anything there, if any of that rings true to you, put a check mark next to question number 5. Question number 6, I have a history of pain in my low back, hip, groin, or tailbone, or have had sciatica. If any of those are true for you, please put a check mark next to question number 6. Number 7, I sometimes experience one or more of the following bowel symptoms: loss of bowel control, feeling unable to completely empty my bowels, straining or pain with a bowel movement, or difficulty initiating a bowel movement. Again, any of those, if they're true for you, please put a check mark. And I just want to reinforce again how so often these may be issues that people just accept as common or normal and may not even connect it to the pelvic floor, but just so you know, they may be connected. All right, number 8, I sometimes experience pain or discomfort with sexual activity or intercourse. If that's true for you, please put a check mark next to number 8. Number 9, sexual activity increases one or more of my other symptoms. Again, those other symptoms could be about pain or urinary issues or bowel issues, anything like that. And lastly, question number 10, prolonged sitting increases my symptoms. If that is true, please put a check. And for prolonged, this would be anything more than a few minutes. So anytime maybe you're driving somewhere or sitting on a bus or sitting in class or sitting in a meeting, etc. All right, so if you checked 3 or more of these questions, if you put a check mark next to 3 or more, then pelvic floor dysfunction is likely, and you may benefit from an assessment from a pelvic floor physical therapist. That was probably pretty enlightening because, again, so many of those issues are things that people just think of as quite common, like back pain or having trouble initiating a bowel movement or feeling like they have to get up multiple times a night to go to the bathroom. Just know that if you have these symptoms, there's often a lot that can be done by actually working on the pelvic floor muscles. And so I do have, first of all, a tip that will help pretty much everyone at least get started. It just gives you a starting place. But the other thing I want to share with you is that it's really essential to know that there is such thing as a pelvic floor physical therapist. A physical therapist is a practitioner who's trained to work with the muscles and the joints and the musculoskeletal system. But a pelvic floor physical therapist works with both women and men who have issues in the pelvic floor part of their musculoskeletal system. So they're going to take a look at the pelvic floor, but also the whole body because nothing exists in isolation. And so they're going to look at everything, but they're specially trained in knowing how to work with the pelvic floor. If you're looking for a resource to find a physical therapist, please check the notes. But first, let's get to that tip. So a really, really helpful tip for pretty much anyone who's dealing with pelvic floor dysfunction is to work on actually releasing and letting go of those muscles, just identifying kind of where they are and learning how to actually relax them. So in some cases, if you have certain conditions, you might end up ultimately wanting to strengthen the muscles and focus on strength and balance and coordination and control. But it's really, really important to, again, start your healing journey by simply identifying the muscles and learning how to let them go and release and relax. Because in order to successfully strengthen anything, you need to learn where the muscle even is and how to let it go. So let's go ahead and just take a brief minute to talk about that. The pelvic floor muscles, they're at the very base of the pelvis, your bony pelvis, and they are the muscles that you can feel squeezing and lifting around the front and the back passages, like around your pee hole and around your anus when you have to pass wind, or if you're trying to stop the flow of urine, you're going to be feeling those muscles and the sphincters in those areas as well. So that's just a really brief, simple introduction to kind of what we're looking at. But we're also looking at the surrounding muscles as well, even the hip muscles, the abs, the low back. That whole lower part of your core is really what is focused on when you're thinking about treating and working with the pelvic floor and with pelvic health. You know where they are now, so let's talk about letting them go. I recommend trying this on an empty bladder, so make sure your bladder is empty. I also recommend lying down on your back. So lie down, simply bring your attention to that part of your body, the pelvic floor, that lowest part of your core, the floor of your core, and think about those muscles that surround the urethra, and if you're a female, the vagina, and also the anus. So the muscles that surround those areas. And even think about your hip and your butt muscles and your deep abs and all of that. Think about all of that lower core. And in that lying down, relaxed position, start breathing into that area. So take a big inhale and breathe and expand into that area. And then exhale, you'll feel everything kind of come back in and up. So again, breathing in, down into the area, expanding, relaxing, and releasing. And then exhaling, breathing out, and feeling everything come in and up. Use your hands too. So think about inhale, expand your hands, breathing in to that area, and then exhale, you can bring your hands in and up, feeling that gentle lift of the area, kind of a pulling in of your abs, and just go back and forth with the inhale, expand, and the exhale, come in and up. Now, focus really on that inhale and expansion and that release. Feel that. Feel everything opening and softening. So the first thing that anybody should do, in my opinion, is to actually work on the drop, to work on the release of the muscles, the opening and the stretching and the relaxing and the releasing. That way you will have a really great foundation to strengthen from if that is the next progression that you and your physical therapist decide is the next best step. So if you need advice on where to find a physical therapist or advice on home programs that you can do on your own or ultimately with the assistance of a physical therapist, please check the show notes. And also I'll provide a link to some more of Nicole Cozean's information, including her website and a video that we did a while ago about whether or not your back pain could be caused by pelvic floor dysfunction. Thanks so much for watching. I hope this was helpful. And if you do think that your problems are caused by the pelvic floor or the pelvic floor may contribute, do not hesitate to contact someone to get this sorted out, because so often, like I said, that pelvic floor can be the missing link. Until next time, remember, eat clean, move every day, and you will shine brighter.